Yeah, so how was the transition to telemedicine?
The transition was initially difficult. I think it was that very first day where we kind of brought all my things. I couldn't stay in my office because I knew that I couldn't handle it morally because my patients would probably be knocking on the door. They would be trying to call in and figure out, how do they see me? And me sitting there hearing that would have just crushed me. So we actually took all of my things. For the first hour I was at home, but then my children, I have 3 little ones, they were all trying to jump all over me. I couldn't really do it. So then I think by that second or third hour, I moved all of my things and my staff over to an empty building that I own. It's an empty warehouse where I then set up like tables and chairs and started seeing patients from there. So initially we said, okay, we're going to do FaceTime and and at that point, I believe the government had said, or maybe it was the following day, that telemedicine, that they would start covering it, that they're not going to put restrictions on what forms of virtual media would use. So I was using FaceTime. I set up a Zoom account that same day, and then I set up a program called Doxy.me, which is used for electronic for telemedicine traditionally. And so it was in between patients we were trying to do that. It was a little bit frustrating trying to figure out, how do I use this and how do my staff use it. And I think everyone was super anxious at the time. It was me and 2 staff members. We were all very anxious and trying to get it done. And it went a lot smoother than I expected, but there were definitely hiccups over the next few weeks.
How is the personal protective equipment supply now at your practice?
So at my practice, I ordered supplies from Henry Schein, which is our supplier. We have a couple of different suppliers, McKesson and these larger suppliers, that I couldn't get equipment the first. I had ordered them from February actually, and never got them. All my supplies got canceled, orders got canceled. They never came, and then it was probably around probably end of March where I finally was able to get some additional surgical masks and get donations from the Vietnamese community. Now I still can't find N95s. I've heard that there are a couple of groups that will sell them for $10 a piece, but you have to buy 10,000, and so I am not able to afford that or buy that on my own. But I'm able to buy KN95s. They're not fit tested, and they're not actually they don't have the correct seal, so it doesn't protect me very well as well for COVID-19 positive patients, but it's better than a surgical mask. So I have those for me and my staff. We actually have bags that we then hang them in, and we're trying to use them at least 4 times because we have about 30 of them right now. And as far as gowns, the normal gowns that we use when we're drawing blood and things like that, I have about 30 of them too, and we're rationing those out too for the next few weeks. And I put in orders, more orders. We got face shields that were donated by the community. There's a face shield, STL face shield initiative, and they were kind enough to donate 5 of them. So, because I have myself and 3 staff members, so 4 of us, and we have 1 extra in case 1 breaks. But those we are wiping down and reusing them. So PP is okay, definitely not ideal, but better than it was initially. So we've been able to be back open to see patients in person about 3 weeks now.
Regarding the Vietnamese community, about what percentage of your patients are from the Vietnamese community?
So about, in my population of patients, I have 5,000 patients that I see, and 90% of the patients are Vietnamese. That's a large portion of my practice is the Vietnamese.
Yes, so have you noticed the Vietnamese community being especially heavily affected at all by the pandemic?
No, actually, I think that because the community was aware from very early on, people had been socially distancing, wearing masks from probably in February. In my practice too, because I was having to wear surgical masks in the waiting rooms and things like that. So I initially had some of the patients who were flying home from Asia who were ill, but now that number continues to dwindle. I'm seeing less and less patients who are sick. So a couple of people I've had sick because they were at work with positive patients, and so they got ill from that. But the Vietnamese patients have been very, very good about following social distancing guidelines, about masking and hand washing and things like that, and staying home. They've been just very good about that.
Yeah, so I've read a little bit about the Vietnamese community coming together during this time and supporting healthcare workers by donating different supplies. So as a doctor and a member of this community, how do you feel about the community like uniting together to help healthcare workers and patients during this time?
So I'm really fortunate to have such a wonderful group of patients and a wonderful community that has really come together. Many of the people in the Vietnamese community work in nail salons or own nail shops, and so they already had surgical masks and gloves and things like that. And so they were very kind to donate them. Probably around 30 people reached out to me after I put out a call on a Vietnamese Facebook group, and donated, even homemade masks. So they would sew their own homemade masks, and I had a volunteer to go pick them up from the patients, or the patients actually dropped them off where I was working. I have one patient who donated probably 1,000 gloves, just boxes and boxes of gloves that, so that's what we're using now. I'm really lucky to have it.
So can you tell me a little bit about your clinic's effort to help provide testing? Yeah. Can you tell me a little bit about your clinic's effort to help provide testing?
Yeah, so when LabCorp finally reached out to me, so I had ordered the supplies for the swabs so that I could do it for myself, and wasn't able to get it initially. And then after the article came out in the St. Louis Post-Dispatch, LabCorp did reach out and was able to give me 5 swabs that I have used over the course of a month for patients that needed it. And then when I was out of those 5, then they were able to give me 5 more. And out of those, I still have 3 left, but I'm trying to preserve them for patients who, if I test them and they tested positive, that the management would change. So if they have very mild symptoms and I suspect that they have COVID, but they're very mild, I'm not using those supplies for them because the supplies are limited. I am now able to do antibody testing. So those people that I suspected, I am having them come back and do antibody testing via blood draw, and have found 6 of those to be positive. That I had suspected but wasn't able to test initially. And this is about 3 weeks ago that we were able to open up. So I haven't gotten everyone tested yet, but it's definitely available in there. And I've let patients know that I'm here to help.
What were some of the main challenges that you faced as a result of the shortage of testing?
So I think the main challenge is really being able to let patients know this is what they have, and contact tracing. I think that if we had the ability to have tested from the very early stages, we could have done a better job of contact tracing and making sure that the people, getting all those people tested too. you know, I had told patients early on that, if I suspected they have something, have them stay home. So I believe my patients that they did the right thing, but that doesn't, if they had a positive, if I tested them, they had a positive, we would have been able to go back and say, oh, they were on this flight. Let's test all those people, or they were at this grocery store. Let's put a call out and say, let's test all of those people. So I think it would have made a difference in contact tracing and finding more positive cases, and reducing the number of cases and number of deaths.
And for those who you weren't able to test, did you notice that they still had trouble getting off of work, or not wanting to go to work anymore?
Yeah, so there were a few instances when I had told patients I thought that they may have COVID-19 or some other viral illness. There was one case where she was seeing me via telemedicine and still working at the same time, and there were people right around her. And I had said, you've got to go home. You can actually get other people sick, and you could be the cause of someone else's death. And I think that I definitely got the message across to her, but but it would have been, if we had seen more positive cases, I think people would have taken it more seriously, and that would have made a difference, I do believe.
And what impact would you say that your testing efforts have had on the community?
So at the, I haven't been able to do very many tests, but I think the fact that I haven't been able to, and then letting people know that that was the problem, made an impact by telling people, you look, we just need to stay home. We just can't test. I can't get tested myself, so I can't get you tested. So I think that that made an impact more than anything. And at this point, with the antibody testing, it is starting to make an impact as far as letting people know that, be assured that what you had a few weeks ago actually wasn't, so that, and you still could get sick, because I think some people think, oh, I already had it and I'm not going to be ill again. And there's a false sense of security there. So when I can do the antibody testing and say, no, what you had back in January was not COVID, it was another virus, then they need to be continue to be more cautious.